London. We will start in a minute or so. We'll just allow colleagues time to assemble. And a reminder that we will be recording this event so that colleagues who are not able to join us today will have access to the resource, and to ensure it's a resource for a wider public health family, both here in London and outside of London as well. But thank you so much to those of you who are already on the call. Wonderful. Hi, Chris. Good morning. Good to see you.
Morning, Kevin. Good morning, everybody. Really good to see you all.
Excellent. We'll start in a minute or so. We're just allowing colleagues to assemble. But again, welcome to those of you who are already on the line. We'll be beginning shortly, and thank you so much for joining us for this London Public Health Forum. A reminder that we will be recording the event so that it's available for all our colleagues across the city, but also available to those outside of the region who are going to be interested in this as well. Fantastic. It's 2 minutes past 11. Let's get started. So good morning, everyone. I'm Kevin Fenton. I'm the Regional Public Health Director for London with OHID in the Department of Health and Social Care and the NHS in London. And it is my great pleasure to welcome you all to this next London Public Health Forum. And today we're going to be focused on a smoke-free London. What does public health leadership in building a tobacco-free generation look like? And how do we build upon the momentum that we currently have, both nationally with the smoke-free legislation, regionally with better coordination between system partners on reducing smoking harm, and locally building on the fantastic work which is being done by all of you at local levels, in partnership with colleagues working regionally and nationally as well. So how do we maximize our working as a system? How do we drive and accelerate health impact? And how do we reduce health inequalities as part of that journey as well? Today we have a fantastic lineup with us. Next slide, please. But before I introduce the lineup, a few housekeeping issues just to cover. So first, as always, we will have a number of colleagues on the line, so remember to remain mute unless you're speaking. Please turn on your camera if possible. And we love when these forums are engaging. Please use the chat for conversations while you're hearing the presenters. If you have any reflections on what you're hearing,
yes,
we may come back to this the chat for that, but also in the Q&A section, please do raise your hands because we love for these sessions to be as interactive as possible. As I said, we will be recording the event for colleagues who are not able to join us, and this becomes a resource which is shared for public health with public health colleagues across the city and available nationally as well. In the next slide, we have the objectives for today's session. By the end of the time that we have today, and this will be for 90 minutes, the objectives are that we will really understand the public health contribution to the smoke-free generation policy and legislation. We will discuss the development of policy and communications on vaping as a smoking quit aid for adults and an additional risk for children and young people. So really looking at policy and comms on vaping. We will be providing updates on our progress in London through better coordination and action through our London Tobacco Alliance. And of course, how do we use new investments into smoking cessation and tobacco control most effectively across the region? What are the emerging best and promising practices on local tobacco control and vaping that we now need to bring to scale for the event in the region? So for the event today, we'll hear from fantastic speakers. We'll begin by hearing from our Chief Medical Officer, Professor Sir Chris Whitty, to provide some of the national context for smoke-free generation, the legislation, or current trajectory on reducing smoking harms, and what are some of the remaining priorities for us as systems and as public health practitioners to continue to accelerate our smoke-free ambitions. We'll then have a chance to reflect on on an amazing career with Deborah Arnott, the Chief Executive of ASH. Deborah will be stepping down from her Chief Executive role, and we thought it would be a fantastic opportunity to learn and reflect on her public health leadership of the past few decades, and to hear from her as she passes the baton on what next needs to be done for public health advocacy and leadership on smoking cessation and tobacco control. And then finally, we'll be reflecting with London leaders, colleagues working in primary care, in OHID, in local government, and with the London Tobacco Alliance on what does this all mean for us in the city as we move from theory into practice, and as we quality improve and we drive improvements in our programs and our impact. What more do we need to do? And then, as I said, throughout the session today, I'll be coming back to you all for questions and comments on what you've heard. So without any further ado, it gives me great pleasure then to welcome Chris, Professor Sir Chris Whitty, our CMO, to give a keynote reflection and address on a smoke-free generation and national plans to reduce smoking and vaping. Chris, welcome, and over to you.
Thank you, Kevin. And I think address is rather a strong term. This is meant to be a conversation with all of you. I will start off, though, with some of the things, particularly around the bill that will be shortly being introduced into Parliament, because I think this is a really major intervention. I suspect Deborah will reflect on that when she speaks. So probably worth just taking one step back. Why do leaders from every political party, major political party, and every nation in the UK agree that we should be taking significant further steps on smoking? And I think it's the thing which people have tended to concentrate on, rightly, understandably, is lung cancer and the link that has to cigarette smoking. Overwhelming evidence, obviously, that that is the case. All of you will be well aware of some of the other very major things that smoking causes. Chronic obstructive airways disease, trapping people in their homes for the last months or even years of their lives, an obvious one. Several other cancers, particularly of the mouth and esophagus and the wider GI bladder cancers, but a very significant increase in cardiovascular disease, both stroke and heart disease. These ones I think are pretty widely known. I think what is often less appreciated is the really very strong impact on multiple other areas along the life course. For example, significant increases in stillbirths, significant increases in premature mortality, and also birth defects right at the early stages, risks of triggering asthma in children, all the way through to a really quite significant increase in the risk of dementia in older age. So the impact of smoking all the way through the life course is really extraordinary. And I think it's that size of effect, firstly, that I think is the principal reasons for trying to act. But there is a secondary issue. So the direct damage that smoking and other inhaled risks cause. There's the secondary epidemic, in a way, of nicotine addiction. And this, of course, is what keeps people smoking. And this is a very critical point to this, because the substantial majority of smokers wish they'd never started. And the reason they're still smoking is because they are addicted. And nicotine is an exceptionally addictive product. So people are therefore trapped into continuing a product which is going to, they know, people are not stupid, they know is going to cause them physical harm, but they've had their choices taken away from them by the addiction that they were induced into largely by industry in early life. Historically, children always at the very earliest point that is possible by law. And the industry has done that very effectively over very many decades. Unfortunately, in particular, this is even worse in areas of deprivation, amongst people who are unemployed, amongst people living with mental health conditions. The rates are even higher in these already vulnerable groups, and nicotine addiction is induced, and then people, as I say, in these groups are trapped, and this underlies some of, not by any means all of, but some of the disparities we see across the UK. And so dealing with smoking will have a major effect on that. Now, the approach that the government has chosen to take is twofold. And it's worth, I think, dwelling on both of them because there's a legitimate debate to be had. The first of them is around a smoke-free generation. And the idea of this is that no person who is currently legally smoking will have any rights they currently have taken away from them. That was the first principle. But anyone who's 15 or below this year, turns 15 or below, or is below this year, will never legally be allowed to smoke a cigarette, to buy a cigarette, more accurately, will never legally be allowed to buy a cigarette. Now, it's not that it will be illegal for them to do the buying. It'll be against the law for the person selling it to sell it to them. So we're not criminalizing at any point the smoker. It's the person who's doing the selling who is actually the principal person who's basically making a profit out of this. They've got to follow the law and only make their profit from people who are legally allowed to smoke, which is those above a certain age range. So really important to stress this, that no rights are taken away from existing smokers and that smoking is not being criminalized by the smoker itself. I think it is, secondly, very important when we're doing this to take head on the argument that to be pro-smoking is to be pro-choice. Because that argument has been put forward by the cigarette industry as a talking point, and they try and sort of force it into the agenda the whole time. And it is, as everyone in this call knows, the absolute reverse of the truth. The whole point of smoking is to get people addicted at the earliest possible age and to the point where they can no longer stop. And then they're trapped with this life-destroying habit. And it is an addiction. And like all addictions, once you're in it, it's very, very difficult without help to stop. And the choice has been taken away. So smoking is actually deliberately taking people's choices away by addicting them to nicotine. And I think we cannot make that point too strongly because it is such a bogus argument put into the public domain by the industry. I think I would also like to just address a couple of other talking points that the industry will always try to put into the agenda because you will be faced with them and you'll want to have an answer to them. The industry will always argue that any kind of restriction on smoking will lead to an increase in illegal cigarettes, the illegal trade. Actually, the evidence is that when demand for smoking goes down, as it has every single time there's been a major smoking intervention, the amount of illegal smoking also goes down. So in fact, again, this is the reverse of reality. And that argument, I think, should therefore be taken again head on, and it is incorrect. Other arguments we might want to come to in questions and answers, but those are really the two biggest ones that I wanted people just to be aware of, the argument that we put and the fact that actually it is, in both cases, the reverse of the truth. Now, moving on to the second part of the legislation, which is going to be around vaping. And here, there's a balancing act, which everybody on this call will recognize. We all want vapes to be available and readily available to current people who are addicted to nicotine through smoking so that people can swap from smoking to vaping. And that is because smoking is so dangerous that vaping is a significantly less dangerous activity. That does not mean it is risk-free. And we know from air pollution that breathing things in through your lungs which shouldn't be there is a health hazard. None of us would want people who currently do not vape to start vaping. But to move from smoking to vaping is a very major step in the right direction. So we want vapes to be available for smokers to move on to. What we don't want is for the industry to try and encourage, entice non-smokers into vaping, and specifically, and the general public feel very strongly about this rightly, they do not want children to be enticed into addiction to nicotine whilst they're still children. And the industry has clearly done that, as anybody going up and down a high street looking at, it's not just the numbers of children vaping has gone up very rapidly, they have, so the data are really clear on this, but you go up and down the high street and you look at the vapes and some of them are very clearly aimed at children. This is not a marketing system aimed at middle-aged smokers. This is a marketing system aimed at children, based on colors, based on flavors, based on placement in shops. So the aim here is to take powers to allow the government to significantly restrict the number of colors, probably the number of flavors, that's for debate, placing in shops and so on, to make it easier, make it harder rather for the vaping industry to tempt in non-vapers and specifically children. That's explicitly the aim. The reason for taking powers on this one is that the risk is that we go too far one way or the other. Either we don't restrict enough and children are still going up and up in terms of their addiction to nicotine, which we don't want, or alternatively we go too far and smokers are finding it less attractive to swap from smoking to vaping. And we need to get the balance right. This allows us to course correct if we slightly overdo it or slightly underdo it. We'll have a first fix on it, which will be laid out in Parliament as to where this is where we're aiming to go, government's aiming to go, but then there is the ability to course adjust subsequently because it's in powers rather than in on the face of the bill. It's a power, therefore there's a bit of flexibility subsequently. It'll have to go through a statutory instrument in Parliament. There's no democratic control. It'll be up to ministers and Parliament will have a role, but it is much more flexible than something which in the bill says this is exactly what will happen. Whereas the smoking stuff is what's called on the face of the bill. That means it's not an adjustment, it's in law. Two other things just to add to that. There was quite a spirited debate about the role of disposable vapes. There are broadly two arguments against them and one perfectly good argument for them, or two arguments for them. The principal argument against them is that they were the principal route by which children are being tempted into vaping, largely because they're cheap and available, and you can do lots of flavors and so on with them, do big ranges. And there's a secondary and very important argument, which the local government has worried about them, which is that they have a very significant environmental impact. Including the risk of fires and a variety of other areas. They're also a vehicle by which a lot of illegal vapes with dangerous chemicals, very high levels of nicotine, so I'll get into the system. Against that, there are some particular groups who find individual disposable vapes easier, some people with disabilities and so on. That's a significant, legitimate concern for smokers who are trying to quit. And there is, for those who are trying to push the benefits of vaping to smokers, having a wider range of tools available does have some advantages. And I just want to make a final kind of general point, and then just make a couple of how the politics is going to play out, small p politics of this, because I think all of you have an very important role on this. The general point is that on the vaping debate, there are 2 points really I want to make on this. On the vaping debate, the cigarette industry knows that this is a slightly more complicated area and has deliberately, in my view, every time there's something which is trying to restrict smoking, has tried to make this a debate about the bits of the vaping debate which they know public health is still debating, and then what they have is large numbers of public health people arguing with one another in public, and then they say these guys can't agree with one another, and and the caravan moves on. Really essential we don't fall into that trap. The second thing is that within the public health debate, broadly, my view is people who start from a child-centered view want to restrict vapes as much as possible, because their worry is every vape is used as a marketing tool to try and get children addicted. So the Royal College of Paediatrics takes a very stern and unbending view on this because it's starting with child health as its background. Others, and Deborah from Ash would be probably, in my view, in this, if she can speak for herself, who start from we really must stop these people who are smokers smoking because that is going to destroy their lives. Want to have a greater range of vaping as one of the tools, to be clear, one of the tools that we can use to help a smoker get off smoking while still being addicted to nicotine, because that's really what vapes are. They're a tool for maintaining your own nicotine addiction, but without the additional very, very substantial harms of smoking. And inevitably, therefore, where people come from on that debate tends to colour where they sit on this spectrum. But really important, and Deborah would agree with me, I think, on this completely, that we don't turn this into a big debate in the public health things. We really agree with the principle, and I've always summarised it pretty straightforwardly. I don't think anyone disagrees with this. If you smoke, move to vaping. If you don't smoke, don't vape. And it is utterly unacceptable to market to children. And that basically is, I think, where the entire public is, and the differences are ones of nuance. Now, finally, a bit on the politics and what all of you can do. The government has decided, as has been happened previously with some major smoking legislation, to make this a free vote. For the Conservative Party, it's also going to be a free vote for at least the Liberal Democrats. I think it's going to be whipped probably by Labour. Don't know about the SNP yet. So that's important. And it's important both in a positive and a negative way from the point of view of getting things through. In a positive way, and this is the bit where this is where I sit, I have to say, is it is our job to win the argument. Not to rely on whips, to actually win the argument as to why this is so important, why this will save huge numbers of people from unnecessary harm. Incidentally, also improve the economy. So the cigarette industry will say, well, we pay so much tax. Answer, they may do pay some tax, but the cost of the economy is much greater. But the big thing is this destroys individuals, destroys families, destroys communities. And we need to make that argument really clearly and take head on the disingenuous and frankly deceitful arguments that the cigarette industry often deploys to try and undermine this. I think if we get this through, as I hope we will, with a majority on every single party, at least every major party in Parliament, I'm not guaranteeing every single one-person party will vote for this, but if we can get this through, that I think is a significant encouragement to make sure we don't do any backsliding subsequently, as has happened in New Zealand, because it'll be very clear we've won the argument across the political spectrum. So I think it is important we do that. On the other hand, of course, it does mean that MPs are going to be voting without being told which way to go. Cigarette industry is going to be doing everything it can to say to people, oh, you're in favour of choice, how could you possibly vote for this? Oh, you know, we're so wonderful for the economy and we look after people so well and all the rest of it. You know, heat not burn tobacco isn't tobacco at all, really. You know, it's only full of nicotine and it's got tobacco, but it's not the proper kind of, you know, all this stuff is going to come out. And it is our job as professionals, without exaggerating, really important we never exaggerate, because we got such a strong argument, we never need to exaggerate on this one. We shouldn't exaggerate anyway on anything, to make the point really clearly about why these arguments are specious and why this is such an important public health intervention. If we can get this across the line, it'll make an absolutely massive difference in the long run. The first people who will be benefited when this goes through will obviously be children who have got health conditions which can be exacerbated by smoking, and those who are around them. Pretty soon it'll start to have an impact on people who have early pregnancies and the big effects that'll have. And that's important because there are still, in some parts of the country, up to 20% of women who are in the last stages of labour are still smoking. Really dangerous for a baby, and helping them to stop is a very important part of maternity services, in my view. But not starting in the first place is obviously way better. And the high smoking tends to be in young mums. So it'll actually have its effect relatively quickly, in fact, on that one. But in the long run, it'll have a really big impact on public health more widely, as everybody on this call knows. Kevin, can I stop there? Very happy to take questions either of a technical or a slightly more philosophical basis.
Thank you, Chris. That was a brilliant overview and such a wonderful way to get us started today. So we have a few questions which have already come up in the chat. I'll start with one on vapes as a medical device. And I wondered if you had any thoughts on that, on how the thinking on that is evolving.
Yeah, so I would like to have, and I suspect most people on the call would like to have, along with a retail offer, the ability to have prescribed vapes as part of the armamentarium we all have. Unfortunately, and I think I know why this has happened, no vaping company has come forward to MHRA to turn this into a medicinal product, which is what you'd need to do this in the ordinary way. Now, why would they not do that? A, because it costs money. B, because they can currently just sell them. So why would you bother going through the process? But C, I suspect their worry is that if we had vapes on prescription, that makes it easier for us to say, actually, we don't any longer need to have these things out on sale. We can actually just prescribe them through the system, which of course is a long way from where we are now, to be clear. But anyway, for whatever reason we don't have a regulated vape product, I would encourage anybody to try and get this over the line, not because we want to replace the point of sale offer for vapes, but because the more routes in we can have, the better. And for some people, a prescribed vape would be an advantage, including people who have free prescriptions, for example. This would potentially be a very good way in to help them get off smoking. Of course, my view is we want to try and get people off vaping as well in due course, but say one step at a time. Getting off smoking is such a huge boon wherever people are on their life course.
Chris, one of the things we know is as we drive down the rates of smoking, one of the things we now have to be really focused on are widening inequalities at the same time, as the behavior becomes more concentrated in those people who may have poor access to preventive services, are not engaged, coming from high prevalence countries and so forth. What might the opportunities be with this new legislation, new funding, to have that laser-like focus on inequalities in the next few years?
Yeah, so you're absolutely right, Kevin. My strong hope is that smoking rates will go down in every segment, but you're correct that the expectation should be they will go down first in the areas where smoking is already lower. That's a win, to be clear. But there will be islands where smoking rates are still higher, and where vaping in non-smoker rates are also higher. And we're going to have to put a lot of concentration in these efforts. Now, of course, stop smoking services tend to be concentrated where there is smoking. And along with the legislation, the Prime Minister announced a doubling of the stop smoking budget, and that will tend to be weighted towards, that's basically weighted by prevalence of smoking. So that'll be weighted towards the areas where they're smoking. London is overall a lower smoking prevalence area than many other cities in the UK. But of course, there are parts of London where smoking rates are still very high. And the expectation is those efforts should go there. And we're going to need to concentrate our efforts to help people in those things, because the smoking industry goes to the areas of deprivation, as I'm afraid does the vaping industry, goes to the areas of deprivation to make their profits from destroying lives. And therefore, that's where we have to go as well.
Yeah, no, absolutely. There's a question, Chris, about what can we learn from New Zealand's experience, and are there things that we're putting in place to mitigate the similar reversal happening here?
Yeah, so the reversal in New Zealand happened for big P political reasons. It was a party issue, but I think one very important difference, and then one important difference of shade, I think. The big important difference is the New Zealand legislation went a lot further than the legislation that's here in the UK, supported in all four nations of the UK, including reducing very substantially the nicotine in existing cigarettes, but also, I think importantly, restricting very, very substantially, really cutting back on the number of outlets that could have smoking. So it went a long way, essentially, in addition to stopping people who are before they start, which is smoke-free generation, also making it a lot harder for existing smokers. So I think that made it a much bigger target, frankly, politically, than the smoke-free generation, which I think has got very wide support. So I think the first thing is, bold moves by New Zealand. I'm in absolutely no way, I'm very supportive of the fact they wanted to try and make it as unattractive as possible for existing smokers to carry on smoking. Nevertheless, I think they went a lot further down the political path than is happening in the UK. Secondly, I think that it does demonstrate that in this kind of area, trying to get all party support, or all major party support at least, is really important. And so because it makes the issues of reversal much less likely. I was absolutely delighted when the Prime Minister announced in his party conference speech he was going to do this from a right of centre government, because I think that sends a really clear message. This is not a left-right issue. broadly. This is about the health of future generations. And I think we should win the argument as far as we can across the widest possible political spectrum we can do so. That is the way we inure ourselves, in my view, to reversals, rather than just squeaking across the line by one vote, because you can whip it through. I think there's a really important job for all of us to win the argument, and all of you will have ways into the political process from every political party, and it's really important we make the case to everybody in sight. I should also say, though, I think there are some people who think that because opposition parties are going to vote for this by and large, not absolutely all of them, that this is going to be a walk in the park. It is not. And I think we should be aiming to persuade every single politician, national and local, of the merits of this case. So the chance of this there being a head of steam to reverse it by a serious majority of politicians, whether it's currently in Parliament or potentially in the future in Parliament — most parliamentarians started off in local government — it seems to me we need to win the argument. So that's my plea to everybody: is don't just wait, let other people do it. Everybody has a role to play in winning the argument.
Yeah, I think it was such an important insight for me, Chris, that actually paradoxically a free vote on this may well be better because it's much more enduring and more robust. But it also means for those of us working locally, the conversations that we have with local councillors who are connected to the party and so forth, continuing to do our advocacy on that is incredibly important as well. So there's a discussion here about doing that locally. So the questions are coming in thick and fast, Chris. I'm going to try and get a couple more in. So the first is around the timelines. We may have an election in May. It may be in the autumn. Do we know about that? Can you comment on that in terms of risks? If it is going to be a snap May election, does this mean that this may be put off for another parliament, or is there still time?
Well, I have no knowledge about when the poll will be any more than you do. I read the newspapers. The newspapers tell me that a May election is pretty unlikely. I believe the newspapers as much as I believe the newspapers. But I think let's make an assumption that it's not in May. Even in that case, to get this through Parliament is going to be the biggest barrier is actually time. Because let us say there was an autumn election, which is the kind of central projection at the moment. As I say, I don't know anything that any of you don't know. You've still got to get it through all the stages in the Commons, all the stages in the Lords. If the Lords does amendments, it comes back to the Commons before it gets through to Royal Assent. So the reason I'm making that point is there will be a temptation, both for people who are trying to delay the bill, which undoubtedly will happen, but also for people who actually want to strengthen it because they're on the public health side of the argument, to put in major amendments that will slow it down. Speed is its biggest risk. So actually, I'm trying to be as discouraging as possible to people to try and strengthen this bill, as well as to weaken it. I really don't want them to weaken it either. I think the bill as it is has got a wide political support. Let's try to get it through before the Parliament comes to an end. If it is just short of the finishing line, there are mechanisms sometimes for getting things through on what's called wash up. But fundamentally, it's much best, and if this goes through all its stages properly, gets proper support in both houses of Parliament, it's debated fully, and then it's essentially settled political space. So but if there were a May election, I think the chances of getting it through are remote, frankly. But that's not my current central view.
All right, thank you. Well, the last question, Chris, is around the NHS, because the NHS has a vested and important interest in getting this legislation through and supporting this. Are any insights into how the NHS is an ally in this and the power of the NHS's voice in helping this to get across the line?
Yeah, I had a chat to Amanda Pritchard and Steve Powis, who's the medical director of the NHS, last night about this, actually. I think there's often an assumption, there seems to be an assumption by quite a lot of people, this is going to be just passed through, we can do it with our hands in pockets, just whistling. I want to really disabuse people of that. The cigarette industry is the most sophisticated lobbying body probably in the world, certainly in the UK, very heavily supported financially. They do not want this to go through. This is going to be tough. And we're going to need all the strong voices, both in local government, in public health, but also from the NHS to support us. And Amanda fully got that point, and I'm confident that the NHS will help to lend its support, because they're the ones, it's jobbing clinicians, speaking as one myself, who most obviously see the impact of this day in, day out, and other than those who are living with someone who's got end stage smoking related disease. So it is very important the NHS does speak up on this, because they're a trusted voice, rightly, and they've got very strong experience of this.
Wonderful. Chris, we've come to the end of our time together. Thank you so much. This has been an amazing start to the forum. We've covered so much, and we are here to support you and everyone else in the national team on this part of the journey. We will do, I think, as we go through the discussions today, think about what more we can do at local and regional level to continue the advocacy, the engagement on this. And we look forward to getting further updates from you and OHID colleagues on this amazing work. Chris, thank you so much. We'll see you soon.
Thanks all, and I look forward to the rest of the conversation.
Wonderful. So thank you, Chris. We'll move on next to a bit of a fireside chat. You know, when the story is told of our journey to reduce tobacco harm, smoking harm, and to promote tobacco control in the United Kingdom, there'll be a number of pivotal individuals and organizations, certainly during my time in my career in public health in the UK, that will be mentioned and be celebrated as well. And I know that the work of Deborah Arnott will certainly be in that cohort of colleagues who are pivotal in helping to both raise awareness about smoking harms, to advocate effectively for the work that needs to be done through policymakers and through programs, through funding initiatives for smoking cessation as well as tobacco control, but also her resolute focus on tackling inequalities as part of this journey to end smoking in our lifetime. So I'm really pleased and honored to have the Chief Executive of Action on Smoking and Health, Deborah Arnott, to join us today for 30 minutes to have a conversation, a leadership conversation on her career and her journey with ASH. Deborah, welcome. Let me start by just asking you, first of all, for any reflections on Chris. Before we get to you, we get into the personal side of things. Any reflections on what you heard in Chris, and what does it mean for you and seeing this part of the journey, and what can we do working with ASH and with others to ensure that we do our best to get this across the line? You're on mute, Deborah.
The horror of mute. Just to say that I am extremely flattered to be in this company with Chris and you and so many others around on this conversation, because this has been a collaborative journey. I've been at ASH this year, it'll be 21 years. And I've seen so much change, but that's been because of collaborative working. It's been because of the clinicians, the academics, the advocacy organizations, the health organisations, all working together with the same aim, which is to eliminate the harm from tobacco. On Chris's presentation, well, as always, it was an excellent presentation, and I think he made a lot of the most key arguments. I mean, there are a few things that I just pick out. One is that we absolutely need to reflect the evidence, and that is always absolutely vital. But I always remember in 2005 talking to a Secretary of State's special advisor and trying to take him through all the evidence of the harm from secondhand smoke. And he put his hand up and stopped me and said, "That's all very well. We all know it's harmful. Just show me the votes." Now, the point is that we need to use the evidence to show those votes. And the whole of the community here has a really important role to play. And as Chris knows, we've been encouraging the public health community to contact their local MPs, to tell them about the evidence and to tell them about why it matters for them. And the more we can get that community to get that across. I mean, we've done a lot of public opinion research which shows strong public support for tough regulation on tobacco and vaping, but also for the smoke-free generation policy. But actually what the public health community can do is give a rounded picture about why that's so important. So, I mean, I think that's the main thing. And I think the points that Chris has made about timing and everything, we're doing everything we can to encourage government to lay the bill before Easter. I think if we get it laid before Easter, we've got a much better chance of getting it through before the election. And as Chris pointed out, as long as we can get it to the Lords, it can then go through in wash-up, which is a period of about a week before Parliament has to dissolve for an election. I agree with Chris. I think it's unlikely there'll be a May election, although Labour are the ones talking it up most at the moment, not the party in power. We won't get it through if there's a May election, in which case our campaign needs to be to ensure that an incoming government, whoever it may be, picks up the baton, because they'll have to start from scratch again at that point. But I think we have got a chance of getting it through. We've been doing a lot of work, and we need all your support to actually ensure that the government understands that, because I think they've been a bit distracted, what with the budget, the Postmasters Bill, various other things going on. And we have to keep hammering home that this is crucial for the future of public health and the future of our children, and they mustn't drop the baton.
Yeah. Well, thank you. And it was really good to get your reflections on this. So we'll come back to this at the end of our fireside chat, Deborah, in terms of where do we go next and what do we do next when it comes to our efforts on ending and reducing smoking. But let's talk about you a little bit. You've been working with ASH for more than 2 decades. What was your journey to ASH, and what, when you look back at your time, are your most precious, most memorable accomplishments with ASH?
Well, I came from a very circuitous route. I left university, went into the car industry, did an MBA, decided business wasn't where I wanted to be, became a journalist and worked in television on factual programs for over 15 years. And I made lots of programs about public policy issues where things were wrong and there were things that needed to be done to change them. And then I'd go on to the next thing and make no difference at all. So after that time, I decided I wanted to leave journalism and become, actually become involved in the public policy process. I first of all moved to the Financial Services Authority as head of consumer education. And that was to try to actually explain to people how the financial system works in order that they could protect themselves. But what became immediately clear is that it's education isn't enough. You actually need regulation. Anyway, after 4 years there, I decided I had enough working in a big arm's length government body. And I'd helped set up a personal finance education charity. Thought, well, running a small charity which had influence on public policy might be much more rewarding. And I looked around and ASH was advertising. And I knew about ASH. I mean, most people do. Well, maybe not everyone, but a lot of people do. And when I looked at the evidence, I thought, well, this is an area where one could really make a big difference. And ASH is the right organisation to work for, because it was set up by the Royal College of Physicians to use evidence to inform public policy. And for me, that's vital. And the evidence base is at the heart of any advocacy work we do. We still work closely with the Royal College of Physicians and with the vibrant academic and clinical community carrying out research in this country. And it's been 21 years of, that have just been the most exciting time of my working life. I've always enjoyed work, but this has been, I think, the most productive. And not because of anything I've done on my own, but because it's within a collaborative community that understands why this is so important and is willing to work collaboratively to achieve change.
What are some of the highlights and maybe some of the toughest bits of when you and I certainly started working together back in Public Health England in 2012, and so we've been working together over the past decade. There've been many highs and lows, but what would you say are your achievement that you're most proud of, and one challenge that you thought that was really difficult in the advocacy space that you had to grapple with?
Well, I think building the coalition has been my proudest achievement, because actually the other things depended on that. When I started, I was recruited by ASH to get a ban on smoking in public places, which at the time in 2003, neither the Labour government nor the opposition, there was a cat's hell in chance of getting. So the fact we got it in 4 years was pretty amazing. That was because of the coalition building we did. Yeah. And also because of the because it's not just about the evidence, as I say, it's about translating that evidence into things that have meaning for the public. And so with the smoking ban, the industry argument was the rights of smokers versus the rights of non-smokers. That was particularly true in hospitality. You know, basically people accepted that you'd ban smoking in hospitals, for example, or in the workplace, but pubs and clubs, no. And when we did our first big survey on public opinion in December 2000, it was May 2004, only about half the public thought that we should ban smoking in pubs and clubs. By December 2005, it was 2/3, a massive shift in public opinion. And that's because we focused on the harms to people working in hospitality venues and why actually their rights outweighed the rights of smokers. And that made a massive difference. So I think that, you know, understanding how to communicate the evidence is absolutely vital. But also it was because we had this massive coalition and it started off small. I think we had a handful of organisations involved to begin with, including obviously the BMA, the Royal College of Physicians, British Heart Foundation, Cancer Research UK, what was then Asthma UK and a few others. There were a few local authorities involved and NHS organisations. We got around 50 signed up and they played a major role in all of this and working with politicians and backbench parliamentarians. I mean, the Health Select Committee, Kevin Barron's role must never be forgotten because he did an inquiry into the harms of smoking and what the smoking legislation should be at the time when the government was saying they'd have exclusions for pubs and clubs in autumn 2005. And at the start of that inquiry, the majority of members of the committee did not support a ban on smoking in pubs and clubs, but the evidence convinced them. So Labour laid the legislation with exemptions, and Kevin, backed up by all the members of the committee who've been involved in the report, tabled amendments removing those exemptions. The Conservative opposition were the first to allow a free vote, as a result of which Labour were convinced to allow a free vote. And getting rid of those exemptions was passed on a free vote in Parliament on Valentine's Day 2006 by a majority of 200. And I think that actually was an important foundation for this non-party political understanding of smoking policy, which is sustained till this day, and was what we had with plain packs as well, where the vote was a free vote. And I think that helps us where we are now. I mean, people say, oh, it's different, government's different, the opposition's different, etc. But actually, you know, we're in a stronger position than we were in 2006, when both the government and the opposition had a true free vote. Whereas this time round, the Prime Minister is supporting it. He's allowing a free vote for his party, but he personally is supporting it. And so is the Secretary of State for Health and various other important people in the party, including the chair of the Health Select Committee now, Steve Brine. But Labour are actually going to whip in favour. So yes, Chris is right. We need to get as big a majority voting for this bill as possible. But I think that's perfectly possible. And I think we're in a strong position to do it. We just need to keep driving forward to make sure the legislation is tabled to pass in advance of the next election.
So a number of colleagues on the line will want to know about advocacy, what it is, how has it changed over time, your approach to advocacy. And already you've mentioned some key elements, building strong coalitions. I love the fact that you keep coming back to evidence and data. Can you take us through what makes great advocacy, and do those principles change as we move forward in time, or are those principles sort of universal and constant? What do you think? What have you learned about advocacy, Deborah?
Well, I think the best advocates understand what's going on in the best advocates when it comes to government, understand how government works. Okay. And I do think my experience, 4 years working in an arm's length government body, and this is certainly something people have said to me, I'm pragmatic. You know, I have strong views about what the evidence shows, but I also understand that you can't just beat officials over the head and say, this is what you should be doing. You know, this is the right thing to do. You have to actually understand the realpolity within which they're operating. Civil servants want to do the right thing. You don't go into the civil service to make money, but they are at the beck and call of their ministers, and the role of advocates is to create that political space for the evidence to be able to be translated into policy implementation.
Yeah, and I love that. That context really does matter and is critically important. We are now looking at, you're handing the baton on a new chief executive for ASH. Hopefully we'll have the legislation passed this year. What next, you think? What are the next frontiers for our journey to create a smoke-free generation and to really reduce tobacco harms? What else will be there if this bill is successfully passed and we move into implementation?
Well, I think we have to put it within a broader context. And one of the things that I think is really impressive about what this government is going to do, and I give due credit to Chris and the officials, and also to the public health minister who has drove this. He's no longer the public health minister, Neil O'Brien. But it's not just about regulation. It's not just about smoke-free generation or curbing youth vaping, which is really important. It's also about helping adult smokers quit. And I think it's important to note that in order to really make a difference, it's not good enough to stop young people smoking. That's really important and will have a massive long-term benefit. But actually, we've got a pool of over 6 million smokers. And the new smokers every year, if we look at 18 to 25-year-olds, we've worked with UCL to model the likely number of new regular smokers each year in that age cohort, which is a key cohort. And we're talking about 127,500 compared to this over 6 million smokers. And the immediate reductions improvements in health, well-being and productivity come from helping existing smokers to quit, because they don't just die prematurely. They also have higher levels of sickness and absenteeism, and on average need social care 10 years earlier than non-smokers. And people who quit smoking at 35 have a similar long-term mortality risk to people who've never smoked. They quit by the age of 45, they can reduce their risks by up to 90%. But this requires investment, and that's why the additional investment in stop smoking services, backed up by the significant additional investment in anti-smoking campaigns to motivate smokers to quit. Because, you know, if you've got a broken leg, or if you have a throat infection or something, you go to your doctor. If you're a smoker, you avoid going to your doctor because you don't want to be told to quit. So you have to motivate smokers. And specialist support can increase success chances dramatically. I mean, on average, it takes a smoker 30 attempts to quit. If they go to a specialist stop smoking clinic, get pharmacological treatment and advice and support, they can triple their chances of success. So, you know, that is vital. And Chris has already mentioned the role that vaping plays. And I think we must remember that, because what Cochrane has shown is that vaping nicotine-containing e-cigarettes is, together with varenicline and cytosine, the most effective quitting aid. Now, it's the only one of those that's available over the counter and is cheap and easy to buy. And we should be encouraging smokers to use it while curbing youth vaping. And we can do that. But the problem is that actually the misperceptions of risk are so big that we really need to do something about that. I've met so many smokers who say, I won't try vaping because it's worse than smoking, isn't it? You know, and actually trying to explain that's really difficult. So getting the balance right, as Chris says, I think is really important. And that's why I completely support the idea of taking powers so that we can calibrate it going forward, and getting rid of the brightly coloured packaging and the, you know, vapes called unicorn shake or gummy bears or raspberry fizz. That's completely unnecessary, and there's no way that's for adult smokers. The other thing, and this is the one thing where I would disagree with Chris, is that vaping is not just about maintaining people's nicotine addiction. I need to look back and find the exact figures, but a large number of ex-smokers are also ex-vapers, and many of them have used vapes to quit. And when we ask people what they want, they don't want to remain addicted to nicotine. They see it as a journey towards being free from addiction to nicotine completely. But the important point is they need, not everyone, you know, I managed to quit without using NRT or e-cigarettes, but for many, the nicotine addiction prevents them stopping smoking, and you need to tide them over. For some people, they may need to carry on using nicotine long term. But if we can help them to stop using nicotine, then we know it's beneficial for people's mental health.
As well. I think Samo actually agrees with you, Deborah, he said in the chat. So we've come to our end of our time, Deborah, with our fireside chat. And colleagues, we really wanted to do a little bit of leadership reflection with Deborah, what it means to do advocacy in this space, lessons over the past 2 decades. Deborah, you have the best of London's public health workforce here on the call. If you had one message to leave with us today, what would that message be?
For London, it would be that the London Tobacco Alliance is a fantastic initiative. And the evidence from the North East, which is the only place which has had a regional tobacco control programme in place for the long term since 2005. And in 2005, the North East had the highest smoking rates in England, 29% compared to 25% for the nation. And their smoking rates have fallen fastest. And in 2022, their smoking rates for routine and manual occupations were lower than average for England. That happened because of a comprehensive strategy. And most recently, matched funding has been provided by the ICB for the region. I mean, they're lucky they have one ICB for their region, but that is enabling them to expand their work. So what I'd like to see is the same thing happen in London. The London Tobacco Alliance is fantastic. It's got great leadership. It's doing fantastic things, establishing a strong ban for London, bringing partners together on important issues like vaping and illicit tobacco. And it's expanding its digital offer for the whole of London, but actually it's limited by funding, and the ICBs in London should be funding it. I mean, and we're seeing that not just in the North East, we're seeing it in York and Northumberland, we're seeing it in Greater Manchester, we're seeing it in Cheshire and Merseyside as well. So the green shoots are spreading out. And if you remember, when I first came and talked to you in 2012, it was one of the things I hoped would be an opportunity from public health moving to local authorities was to expand those regional networks. But in fact, when funding for the public health budget was cut in 2015, the 2 other regional programs in the South West and the Northwest were both abolished because of the funding cuts. So now there's a massive opportunity. So in London, what I want to see is the ICBs to put matched funding into the London Tobacco Alliance to provide that regional approach in London, which has such massive potential. And already London has something, I think you pointed out, London smoking rates are lower than, certainly a lot lower than the average for England. London could be the first smoke-free city with smoking rates below 5% if the investment is made.
Fabulous. Well, as luck would have it, we have a number of NHS colleagues on the line with us today. And next, in our next panel, we also have colleagues from the London Tobacco Alliance with us to talk about what this means for London and to lead the charge, as Deborah has given us, on making London smoke-free. Deborah, thank you so much for joining us this morning and for sharing. Please do stay. We'd love to hear your thoughts in the chat as the panel discussion with London Partners starts now. So Deborah, on behalf of our colleagues, thank you for joining us. So Colleagues, we're on the home stretch for the London Public Health Forum, and in the last session, as always, we get a chance to meet some of our key London leaders who are working to support both implementation of effective programs, really supporting innovation on smoking cessation, really thinking about youth vaping and how we end that in the city, but also tackling issues of illegal tobacco and a range of other tobacco interventions. So I'm going to introduce and ask Agatha, Michelle, Showman, and Tracy to come on camera. I think I have fantastic. So our four panel members are here, and I'm going to ask, first of all, very quickly for colleagues to introduce themselves and to maybe share one thing that they've either learnt from Chris and Deborah this morning, anything new or anything that has resonated with you. So if you introduce yourself and one thing that has resonated with you this morning so far, and then we'll jump straight into the questions. So we'll start with Showman, and then Tracy, Michelle, and Agatha in that order. Showman.
Great. Thanks so much, Kevin, and thanks so much, Chris and Deborah. So I'm Showman Bunji. I'm a Director of Public Health in Tower Hamlets, but I'm also the ADPH London lead for tobacco, and Tower Hamlets hosts the London Tobacco Alliance. Tracy is the programme director. Just one thing that I really wanted to share is like Deborah said one thing which actually summarised my job description as a Director of Public Health. She said that the role of an advocate is to create political space to allow evidence to be put into policy. I've written that down and highlighted because that is actually what we're all about at the local authority level. So thank you for that, Deborah. And thanks for all the work that you've done, and we've worked together for many years. So thanks so much.
Thanks, Showman. Tracy. You're on mute.
Apologies. Thank you, Kevin. I'm Tracy Parr, the Programme Director for the London Tobacco Alliance. And I came in, was brought into this role to set up the Alliance. And my observation when I started was that we had loads of fantastic work going on in London, but it was not greater than the sum of its parts. And that collaboration, which both Chris and Deborah have spoken about, bringing partners together so that actually we've got the same hymn. I sing in a choir, so let's have some choral music in the background, but let's really have a collective voice and collective drive to take us to smoke-free 2030. And if I'm allowed a second one, Deborah, your point about additional ICB funding would be amazing, because having the ICBs round the table with match funding so that they can really shape where this is going in a much more kind of cohesive way would be an incredibly positive initiative.
Wonderful. Thank you, Tracy, and welcome, Michelle. Introduce, and what's your reflection so far?
Thanks, Kevin, and thanks everyone for speaking so far. My name is Michelle Kemp, and I'm part of the London OHID team, working on alcohol, tobacco and drugs. For me, it's not so much about kind of the words that were said, it was the energy that was brought to the table. Spending quite a lot of time, exciting time at the moment with a lot of partners, kind of with lots of resources for once. And energy and kind of interventions coming in, and it's just feeling kind of reassured that that energy is kind of running through everything that we're doing at the moment. So for me, that was it. It was about the passion and the energy that just kind of really reflecting on as I'm listening.
Wonderful. Thank you, Michelle. And Agatha.
Hi, and thanks for inviting me to join this panel. I'm Agatha Naughtley-Mesher. I'm a South London GP, and I'm also the London Regional Medical Director for Primary Care. And I was about to say what Michelle said. I think for me, it's about the collaboration. We've got partners from all over the system here in this event today, and even across the panel, and I think it's about that collaborative effort. This is within all our gifts, and it's about how we bring it together. So I think from the conversations, it was the energy, it was the passion, it was the will to say, actually, do you know what, we're going to do this, and we're going to make London smoke free, and we're going to do it together.
Yeah, I love that, Agatha. And I love also the challenge that Deborah made about London being smoke-free
Let's do
first,
it.
because we're on a really strong trajectory. So how do we build on this? So I'm going to ask each of you, from your unique perspectives in the system, what are you doing and what more can you do to accelerate our efforts to get to that smoke-free generation, smoke-free target? I'll start with Tracy, Agatha, and then I'll go to Showman and Michelle, just to hear what are you doing in London and what more needs to be done and what will you be doing? Tracy.
Thank you, Kevin. And I suppose there are a number of levels really that we work on, but in the London Tobacco Alliance, we're very much about bringing people together. So we have a number of networks, and I put in the chat that we support Smoke-Free Counsellor Network. We run the London Tobacco Control Network, and we're setting up an academic network. So bringing people together is good, but not just for talking. That actually does need to be some action. Agatha and I often have discussions about this. And I have to say the additional funding coming into the system is incredibly helpful. There's 9.7 million coming into the London boroughs, and I think let's be creative. So we've seen that some of the evidence shows that, you know, for some people, a local service is not what they want, even if it's directly aimed at a specific population. Lots of those work, but we need really a whole menu of support for people. And that's why we're looking at what does a digital app offer look like in London for Londoners that complements local services, that's available 24 hours a day, and gives an alternative approach to helping people stop smoking. But what that requires is collaboration, and we've had fantastic support from the directors of public health, who have, the majority of whom have supported this initiative. So how can we collaborate to get economies of scale across London so that local stuff happens where it needs to, ICS stuff happens where it needs to, but where we can really see a pan-London view and reap the benefits of that.
Thank you, Tracy. And that coordination, collaboration with focus has been a key strategy for success with both in other regions on their smoke-free journeys, but also other programs as well. So the value add of that collaboration at the London level proves itself over and over again. And you're absolutely right, with the new investments coming in, let's think creatively, right? Because we can both invest in what we've always done, but that space for innovation, I think as you challenge us, we should be open to that as well. Agatha, how about you? What's your role in this space? What can primary care do more of as we move towards smoke-free?
My role is around primary care transformation in London and working with the 5 ICBs to support that change. The change is happening on the ground. It's not us doing the change, but it's about how we lead that change. And part of that transformation is around the fuller stocktake, which came out probably a couple of years now, but has 3 pillars. One is access, and we're working really hard on that. But the other 2 are around prevention and long-term condition, supporting people to live longer with long-term conditions. And actually, although the fuller stocktake appears to be a primary care document, it's not primary care, it's not just primary care, again, it's whole system. The prevention agenda needs to move upstream, and we need to work together across primary care, secondary care, community to lead on that, but also how we support people to live well with their long-term conditions. And I think for me, and Tracy knows because I'm always jumping on my soapbox about this, if we're really talking about prevention, then smoking is the first thing on our list. It's the first thing we need to tackle because it causes everything, and it makes everything worse. And so there's something about how we put that at the top of the agenda. So part of what I'm trying to do is ensure that is at the top of our agenda. We have clinical networks in London. We have respiratory, cardiac, and diabetes and renal networks that have actually come together as a cardiometabolic, because again, as a GP, no one patient has just one condition. They have several, and actually we need to look at people holistically and in the round. So as part of that, it's how we bring smoking cessation to the front, but also how we make sure we have practical services at the end point, so that people can have that proper practical support. And that's not just the NRT, but also the the psychological support. People know smoking is bad for them. We don't need to, you know, tick smoking cessation advice given, but actually people know, they know it's bad for them. That's not why people smoke. People smoke because it's addictive. People smoke because of socioeconomic reasons. People smoke because of life stresses. There's so many factors that influence that. And I think we need to get smarter around how we support people to stop smoking, and not just tell them just stop smoking, but actually build things around them so that we empower them to do it well. Yes, that's kind of the arena that I'm working in, and looking forward to working more with Tracy and team on doing that.
Wonderful. And that more holistic approach to our efforts is critical, as we had said with in the discussion with Chris. As rates fall, you can expect to see higher smoking rates in those with comorbidities, dealing with economic and social factors, dealing with the social and structural determinants of health. So what you're describing, Agatha, about how we wrap around and how we think about those wider determinants become even more important. So really good to hear that you're focused on that, and that becomes part of what we do as we get towards smoke-free. Showman, from the Director of Public Health perspective, local government perspective, what are you doing and what more can we do?
Great. Yeah, thanks very much, Kevin. So I think as a Director of Public Health on the London Tobacco Alliance, my role is to really reflect the challenges and the goals of people at local authority level. I kind of think about this in terms of, you know, the next 5 years. I was looking at the task ahead of us. I was looking at the targets that we have over the next 5 years, and thinking through, well, how do we get to a point at which we have a 150% increase in quits in 5 years' time? So I think, as Tracy was saying, that is going to be quite a creative process, because we have our services in place, but how do we use the money so it has impact? And that is a discussion that we need to support each other across local authorities, share the learning and opportunities, and continue the sort of evaluation of what we try to do. So I think that's one thing. The other thing I was thinking was that if this legislation is going to get through around an age of sale, we are really going to think about local enforcement, and we are going to need to think through how that money is used. Sorry, I think we got a bit in background, but I'll keep speaking. Yeah. So I think sort of advocating for local enforcement and thinking through how we would enforce that legislation locally will be important. The third thing I wanted to say, and this is just my thing, and it links with what Agatha was talking about, is I still feel that what would be really fantastic would be a change in the culture around in the health and care system, and going back to what we had a few years ago, which was a concept of smoking as treatment. I still think it's really crazy that, you know, you're quite happy to prescribe statins or medications, but not give smoking cessation equal treatment. The thing I would love to happen is that it's a real step change in the training of health and care providers. So medics, nurses, healthcare assistants, just a real uptick in that, because I think that will both change the culture and help people, support people to stop smoking. So those are my things, Kevin. Thank you.
Wonderful. Thank you, Showman. And you know, this issue then of how we leverage resources, right? Whether through the public health grant, but also how we combine that with resources in the NHS for great impact is really key. And yes, we may be getting additional funding to stop smoking services through the new program, but it shouldn't mean that we don't get the additional funding from ICBs and we don't get the NHS contributions as well. So I think there's an element here of advocacy. And then just to reflect on what you've said about in that journey towards elimination, being clear about what we need to do to get there. And I'm not sure if we've been as transparent and as explicit about what step up in smoking quits, in smoking cessation service access, in the numbers of campaigns and the funding of campaigns we will need in order to maintain our trajectory. I'm not sure if we've done that as yet. And maybe that's something that working together with our London Tobacco Alliance, we can make that pathway to elimination far more explicit. So thank you, Shulman. Michelle, OHID's doing a lot of work in this space, and I guess OHID London is extremely busy trying to support systems. What are you focused on, and what do you think are the things that we need to be doing in the year or two ahead?
Thanks. I think I always feel like I'm in quite a privileged position because I have the opportunity to hear what our populations are saying and ensure that that message gets fed up through kind of the national kind of teams. At the same time, as soon as I hear anything from a national team, being able to kind of ensure that communication is spread through the system. For me, I suppose the focus has been on we're in a great position with lots of national programs and additional investment, but how to ensure that we don't create unintended consequences, particularly when we think about health inequalities, because what we know is our local authority colleagues are all at different positions in terms of their development for their services. So which is a lot of the work I've been doing, particularly around some of the national programs, so Swap to Stop, and also coming up with the smoking and pregnancy incentive schemes, is to make sure that things are rolled out kind of through an equitable process, so we don't have kind of gaps and we don't have kind of postcode lotteries, which is not easy when we're not all starting from the same standing point. So a lot of work around that recently, and kind of feeding back up if you know there are problems at a local level and how we can kind of address that. So it's a real kind of thinking about how the local authority allocations will be used going forward to make sure that what we don't do is repeat what's already there, to make sure that we don't rush with this money to kind of feed gaps without actually taking a step back and thinking, how does the local authority new allocations sit within a wider tobacco alliance focus at a local authority level as well as an ICB level, as alongside the regional level, as we've talked about. Because I think there's a tendency when we see that there's some money coming into the system that we quickly plug a gap without thinking about what might happen and whether there's going to be kind of problems we create. And I suppose that's where the focus has been recently.
Fantastic, Michelle, and a really important lesson there, right? Because as systems are increasingly under stress with the reductions in the effective spending power of the public health grant, with challenges across systems for funding, whether NHS, local government, and the wider local government settlement, as you say, any pot of money coming in, there's a danger that we just say, yes, we can use this, rather than keeping the collaborative focus. And I will always say that when times get tough, what systems need to do is to work even harder to collaborate. Right? Because that is what gets you through the tough phases. And you have to avoid the tendency of going inwards and becoming more isolationist as funding and as environment gets more complex and more difficult. And I suspect it applies to this as well. So colleagues, I'm going to open up now for questions. If you would like to ask any questions to the panel, please raise your hand, please put them in the chat. We'll, in the meantime, see if there are any questions in the chat itself. But Tracy, I'll bring you in first, and then we'll go to some questions. Yeah.
Thank you, Kevin. Just briefly on that point of, you know, money coming into a system, especially we have some boroughs with no service whatsoever. It is a real challenge, and in recognition of that, Robert West and the Public Health Behavioural Science Network approached us to really try and support London boroughs, and there are materials available looking at how people can take a stock take of their population, and bearing in mind we've just got huge variety in some of the best services and the non-existent services, so just trying to really share that learning and support people to think about where they will get most impact for that money, I think is really helpful, and we're very grateful to him and the Behavioural Science Network for that.
Yeah, and I think colleagues are just dropping some assets in the chat in terms of resources, articles as well. So please, colleagues, do look in the chat because it's ending up there's just lots of great resources there. Michelle, one of the challenges that we have in London is a highly diverse, highly mobile population. We have many Londoners who come from countries where smoking is very common, highly prevalent. Can you reflect on what we might be thinking about in terms of cultural competence, thinking about diversity of our populations, and Showman from a sort of local government perspective? I'd love to hear your thoughts on that as well, because it may be that part of the challenge we will experience in London, being a global city, is, you know, people coming in where smoking is still the cultural norm. So, Michelle, starting with you, any reflections on that, and then Showman?
Oh, it's interesting because I'm just kind of catching up on some of the chat actually as you were talking, and I could answer that, but I'm wondering whether one of our local authority colleagues might actually want to explain some of the work they're doing, and I could pick someone, but that would feel really unfair. But I can see that Steve Whiteman for the South East London ICB has actually put something in, and there's been lots of discussions kind of in that ICB as there have in Showman's. So I don't know if Kevin, if you want to go to some of our colleagues that are already delivering on this work first, and then I'm happy to come in afterwards.
Fantastic. That sounds like a plan. Well, let me go to Showman, and Steve, if you're happy to speak, if you just raise your hand, I'll come to you as well. I don't want to put people on the spot if they didn't plan to speak today. So Showman, we'll start with you.
Thanks. Thanks so much, Kevin. So, you know, as a sort of DPH in a very diverse borough in Tower Hamlets, I think one of the key things is really to understand the drivers in specific communities. You know, what works within specific communities. So, for example, you know, for us, it's the Bangladeshi media. We have people in our team who actually appear on Bangladeshi TV, for instance, or we go to the mosques. We really, you know, we think about actually where could we creatively put our outreach clinics so that they'll get more uptake. But I feel you need to do, you know, you need to get the insights and you need to do work around that. And I think that is also something that I'm aware of that we can do with the London Tobacco Alliance, because the learning in one part of the borough of London will be transferable potentially to other parts. And so sharing that learning is really important. So yeah, I'll stop there, Kevin.
All right, wonderful. And I see Steve has actually put his hand up. Steve, great to see you. Please come on camera if you'd like and tell us about how you're addressing this issue of cultural competency and targeting.
Hi, Kevin. So in South East London, we have a tobacco network that's been meeting actually for a number of years, but in the last couple of years has been taking on more of a role around things like overseeing the long-term plan implementation in trusts. But alongside that, we've been working together across the local authorities as well as the NHS in thinking about what might some of the more innovative things be to try and really drive up the numbers of people seeking tobacco treatment. And actually, I think sort of links to what Showman says, really thinking about the way that we work differently during the pandemic in terms of working alongside our diverse populations and communities with the community voluntary faith sector and residents themselves to really develop activities and strategies with our communities so that they are sort of tailored and targeted in ways that will speak to and work with and reach people rather than potentially widening inequalities. So we're kind of working on a number of different innovative programs, quite a bit in the NHS actually, looking at the costed model around ED, tobacco treatment, dusting off the stop before the op kind of thinking. Working with the targeted lung health check program as that rolls out across the country to try to influence that program so that it has tobacco treatment as an integral part of the program, which it doesn't currently. So there's a bit of advocacy to be done in that space. So yeah, lots of interesting things. And I put in the chat that our ICB is actually putting some money behind this, so we're kind of able to put some of our own new money together from the local authorities, 6 local authorities, but also hopefully maximise some of that additional investment from our ICB colleagues.
As well. Steve, thank you so much. And it's just really wonderful to hear just the innovation and the partnership work happening at the sub-regional and local levels as well. So thank you so much for bringing that to light. So colleagues, we have just about 5 minutes left, and no conversation on smoke-free generation ambitions would be complete without reflecting on vaping and its role in the city, both the challenges and the opportunities. So in no particular order, I'm going to ask Shulman, Agatha, Tracy, and then Michelle for your final words in terms of both the challenge and the opportunity, and where we need to, you think, prioritize our actions on vaping in London. What do you think or laser-like focus needs to be at the moment? It may be supporting national interventions. In addition, there may be things we need to do uniquely in London, given our data and our epidemiology. So, Shulman, we'll start with you, and then Agatha.
Great. Thanks. So I think, Kevin, the strength is we do actually have clarity on our message. And I think Chris stated it really well. So we have clarity on the message. I think that the nuanced conversation and the challenging conversation is the one that Deborah outlined, which is actually, why are we not advocating vaping for people who are non-smokers? What are the harms? Yet at the same time, not putting off existing smokers from taking up vaping. And so I think that is the area that we need to focus on. We need to think about how we speak to parents and about the issues. So I think that's where we need to focus.
Yeah, and I think our work on the lines of a clear and unequivocal a statement on preventing kids from taking up vaping. And then, as you say, as CMO has said, providing that viable alternative for smokers is what the Tobacco Alliance is pushing, and we're aligning that with all of you working at the local level. And that has to be part of our work going forward, that clarity of mission and clarity of voice on this. Thanks, Shulman. Agatha, how about you from the NHS's perspective? What needs to be done?
About vaping, I think I would agree. The risk for children is something that is a major concern, and I think you know, the fact that most of the vapes look like sweets, the bright colours, the names, the smells, they are marketed towards children, and there's I don't know if it's within our gift or not, but there's something about that just needs to stop. It just needs to look like a very bland, plain product that grown-ups use. And that's not attractive to children. So I think that's the first thing. I think the other thing is, and it was mentioned a bit earlier, is of course people will use vaping as a way to stop smoking, and then they still have that nicotine addiction, and it's how we build in that support so that it is part of that journey. And then there's support to stop vaping as well. Obviously we do need a consistent offer in London, and I think that's been mentioned already in terms of the practical nicotine replacement and the wider support to help people come off the nicotine in itself. But I think we need to apply that to smoking in the first instance, and then to vaping, so that people have that support end to end from start to finish.
Wonderful. So we have a couple of minutes left, Tracy, and then Michelle.
Thank you, Kevin. And so, yes, Chris is crystal clear about his message, and we really appreciate that. That messaging is not getting to all parts of the system. It's not getting to some of our elected leaders. It's not getting to others. And I have been in debates about smoking where suddenly the whole debate is about youth vaping, and bringing the debate back to the harm caused by smoking. This is really complex and nuanced. And actually, my plea would be that some of that 25 million going into the national campaign is really, really used to have an effective messaging campaign. Because if we can do something in London, but actually if that is devised, developed, is consistent, and we can amplify that, that would be enormously helpful, because I am still fighting a battle of people who think vaping is harmful. And so there's complexity here, and we have to think of a multifaceted approach. But I believe this audience is probably one that is convinced, but there is a much wider audience, and I think we still need to do quite a lot of work there.
Wonderful. Thank you, Tracy. And Michelle, only a few seconds left, but your last words and hopes for our vaping action in the city.
comes back to everything that everyone else said. Just because people shout the loudest, it doesn't mean it's the most important thing. It's important, but we mustn't lose the messaging around kind of quits and kind of, you know, kind of the benefits of vapes, while supporting all of our colleagues to ensure that young people don't take up vaping or smoking.
Brilliant. Michelle, thank you so much. Colleagues, as always, it's been phenomenal to spend some time with you all on this London Public Health Forum. I really hope you've enjoyed the session today. It was wonderful to hear from Sir Chris, really laying out the journey towards a smoke-free generation, and really how do we harness the sort of political momentum that there is on this to help us to turbocharge the next generation of action on smoking. Fantastic to hear from Deborah Arnott, reflecting on her 2 decades of leadership of ASH, but more widely, what she's learning and has learned about advocacy and impact and what it means for work. And I hope that by listening to London colleagues and the work that's being done in the city, the diverse perspectives from the London Tobacco Alliance, OHID London, the NHS, and Directors of Public Health, you can see opportunities for coordination, opportunities for impact, and the resolution, and as Michelle said, the energy and the passion for this work. So thank you all for joining us today, and I look forward to seeing you all in our next London Public Health Forum, which may be in person later on this year. So we'll be working together to see if we can bring the family together in the region to reflect on our practice in public health and to support each other on this journey. Thanks, everybody. Take care.
Thank you.
Thank you. Thanks. Bye.
Thanks, everyone.
Thank you. Bye.
Bye.